Alright, welcome to Nesting with JYK again for second time tonight, at least in my local time zone. I kind of just dug a bit deeper into this whole situation, and I thought this is somewhat useful, and yeah, just bear with me. So I checked on Google of this interview, and it seems like the content is only available in Chinese, and I think this might be useful to you. And this also is somewhat crucial in forming one's projection of the future, one's prediction of what the future might be. Right, so this is the same, let's call him CEO of Dingyu Hospital. So there was he did a interview with a bunch of Chinese doctors in Northern America, and then he said some things that might be interesting. Here's a summary. It said this thing, which is ritonavir, is somewhat effective, and then you have remdesivir, which I just talked about in the previous live stream. That is also effective, and here's a third conclusion that he came to, which I guess means that what I previously in one of the videos I made before it was incorrect. That once you have ECMO, you're most likely to die. This is different from many other respiratory disease that once you have ECMO, you kind of recover and then you get discharged. But in this case, once you have ECMO, it's kind of irreversible. You just die. And then the plasma therapy, so essentially injecting plasma of the cured patient into the critically ill. It is helpful to maintain their blood oxygen level. And then the next thing is that if you do a swab in their throat, it doesn't show viral loads, but if you do a swab in their anus, it does. And then the disease progresses from the bottom up in the lung. All right. So I'm just basically just translating, so it can be very boring. So if you're not interested, just turn off the live stream. It's basically a translation. You can also get this very easily by translating using Google Translator and through this URL. I think the URL is the most important part. Just translate that. So the guy. So the experiment with ritonavir was done without placebo, so it's not scientific. Right? So take it with as big of a grain of salt as you want. So that's what he said. So he did that, and then there was I guess 198 patients, and then he said it looks like it can reduce the death rate. And there's some, this is not too important, it's very technical. And then he said they have very high confidence in ritonavir, which is an AIDS drug. but there are some adverse effects, and it seems like the adverse effects around the digestive tract. You essentially develop diarrhea, nausea, and vomiting. And it seems like there are more of these effects compared to the AIDS patients. And it seems like in this case there are patients that cannot withstand the adverse effects in their digestive tract. So one way of interpreting it, and certainly it's one way of me trying to make sense of it, is that this virus attacks your digestive tract as well as your respiratory system. And the other problem is the interaction between different kind of drugs. So he said this is not how I translate. This is the thing that controls the blood sugar level. So insulin or some kind of, but insulin itself is not a drug. So he's saying something that control the a drug that lowers the blood sugar level, and certain beta blocker, the beta blockers. So what are the beta blockers? I checked on Wikipedia. Apparently, the beta blockers is a thing that that is used to manage abnormal heart rhythms. So something that affects your heart, and if you take ritonavir, you end up with just dangerously low heart rates, 30 to 40. A normal person would have, when you're resting, would have like 50. So that, and he, I say again, just repeated. I'm not a medical professional, right? So I'm trying to understand this as much as I can. Whatever QT means is essentially he just repeated that you have some kind of delay for the QT interval, and then that just makes your heart beat slower. And then he said after 2 weeks of using ritonavir, he was trying to tell people be careful of using this drug. And then the other thing that he observed is that they randomly visited 1,000 HIV carriers, and only 3 to 5 have coronavirus, COVID-19. And he said at least less than 10. So less than 10 people have the infection, and that's much lower than the average citizen's infection rate. Okay, so here is an important data point, because this puts a floor on the number of infected average citizens, because that, he said, that's then less than 1% infection rate. What we know is that Wuhan has 10 million people, right? So if you have 10 million, and then this is 1%, or even if, let's say, we have half of the 10 million left because of Spring Festival, you still have 5 million there. And if you divide that by 100, which is, he said, far lower than the infection rate of average citizens. So let's say far lower is conservatively 30%. You're talking about 30% lower. That, what is that? That is so 1%. So 1 divided by 0.7, you're 1.48 times 5 million. Sorry, 700,000 infected. Remember, the report is at 74 or like less than 100,000 is infected in the entire Chinese population, right? So this tells you a lot about the underreporting. Anyways, so he's saying that if you end up with less than 1% infection rate, that is very low. Keep that in mind. And then the other thing that he said, the other reason that I recommend ritonavir is my own experience. I have this is the actually the ice bucket challenge. I don't know how to translate that, but it's the thing that makes all your bodies go crazy. Yeah, that thing. So he said after using some kind of drug, he's not infected. His wife was infected. He had a close contact with her, but he is not infected. So he thinks that the anti-AIDS drug can potentially have an effect of suppressing viral replication. And then he said we are preparing to finish the random visit of 5,000 HIV infected, and they already did 1,000, and once they finish the 4,000 later, they want to have a more detailed evidence to prove that the antiviral suppressant and protease suppressant the combined use of the antiviral and actually this is maybe there's a word for this in English. Let me just see. Nucleotide reverse transcriptase inhibitors. That, whatever that is, that. The combined use of those can prevent the replication of COVID-19. And he said, whatever this is, there's another drug. I think this is umifenuvir. He said we have no experience and they don't know anything about it. And then this is the remdesivir that I actually talked about in the previous live stream. Okay, and let's see. Hold on a sec. What do we have here? Okay, so then he talks about the treatment of the heavily ill and then the critically ill. And then he said that there's no way of treating them. In fact, up to now, as long as you did a intubation, most of them don't come back. So this is just intubation. He says if you have used ECMO, there's only one guy that survived. Everybody else died. So what I said about ECMO in one of my previous videos is wrong. So if you use ECMO, you die, basically. Very high chance of dying. He said he really hoped there is a drug that could stop the slipping into critically ill. And he said ritonavir does seem like to be effective, even though their evidence is not strong. There is a typical patient, I don't know how he defines typical, but it is a typical patient that uses ritonavir his 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 disease had a very long uh, a long course, and he had very extensive damage to his lung, and uh, he still could not live without additional oxygen, but he survived. He is very his lung is very damaged and is fibrotic. It is in the absorption state of the fibrosis. So his body is absorbing his own fibers, the fibrosis that develops when your organs are healing, the tissues are healing. And he said up to now he can only he can only satisfy the air exchange under oxygenation. And then we expect this patient to die without using ritonavir. So that's him saying that ritonavir is somewhat useful. And here's the thing that kind of bugs me: why we don't just stick with the stuff that seem to work, right? Just do more experiments. It is cruel for the first batch of patients that some of them have to die to prove that a drug works. It is cruel, but if you look at it in the other way, they're gonna die anyways if there was no experiment, right? So instead of using this stupid, some Chinese traditional medicine does work, but a lot of things can work. You need to prove these scientifically, and there's a cost associated with that. It's just anyways. And there was another one that used ritonavir, but he had digestive side effects, and he could not keep using it and only use it for 2 days, and then he ended up with intubation and used ECMO, and he died. So he said that the plasma therapy was used for 5 days at the most, 6 patients, 4 ill and 2 critically ill, 4 heavily ill and 2 critically ill. And he said overall it seems okay. What does okay mean? One is that the blood saturation level was improved. Second is that the number of lympho cells is increasing, and then they feel better themselves, and then is observably better in terms of their mental status, or I don't know how to translate this, but like they appear more energetic, I guess is one way of translating. And then he said once they used the plasma, they end up keeping their blood oxygen level, and that's a good thing, because once you have intubation, most of them, they just slip into the abyss, and it's and go to a irreversible course. And then here, this part is actually more encouraging. So I thought this was kind of, at least for myself, it was interesting. So he said he did. What is this? He said that after tens of days, once they develop symptom, you do a throat swab, it shows up negative. But if you do an anus swab, it shows up as positive. So there's another thing that basically says this virus will fuck up your digestive system. So that he said there was a critically ill guy and a famous patient, famous in whatever sense, Once he came in, because he already had intubation indirectly into his trachea, uh, we are we obtained the secretion uh, from his mask, because the guy was already intubated, and then he did a few throat swabs, and all the RNAs were negative, but his anus swab showed very, I don't know how to translate this, but essentially I think it's like high replication. What does that mean? I'm not sure if I understand this correctly. Copy number, high copy number. Some of you are more well versed in this area, then explain that to me if you could. But yeah. So had high copy number virus RNA, and so what he said is that the detection, the PCR detection, the low positive rate, essentially what he's saying is high false negative rate. He feels like it's a problem of sampling, and then he keeps going on is that it says that if you check for SARS coronavirus, a lot of that would show up as positive because it's very similar. And when they heard that the throat swab doesn't detect this RNA, the entire all the 7 patients went through this thing called bronchoalveolar lavage. So lavage, I think, is some kind of a washing. Bronchitis, bronchus. So the split trachea thing you have, and alveola. So you're part of so the washing of your bronchus and your alveoli. I'm not sure if I actually are pronouncing these correctly, right? So forgive me if I do pronounce them incorrectly. But so the washing of your alveoli and your bronchus does not, in this case he said, does not the result is that the Wuhan CDC and Wuhan Virus Investigation Bureau, or whatever it's called, each had 2, and then detected two patients all were positive, and then they said they were able to detect that the SARS, they show positive as a SARS coronavirus as well. So they either detected 2 or 4, but not everybody. And then he said then they used other detection methods, and in fact all the patients are RNA positive. So he believes that the false negatives are a problem of sampling, not a problem of the actual detection. So that's actually encouraging. So as long as you detect the correct thing, you can detect this. You can detect the infection. It's not that the kits are malfunctioning, which a lot of people seems to be, at least what I read over the internet, a lot of people seems to be speculating. The kits are actually good. It's just the sampling is a problem. And then here is that he said we cannot do this lavage for all the patients, and he said the infection seems like it started first, it attacks first the lung, and then it starts at the bottom of the lung, and only when the virus is replicated enough, it goes to the upper respiratory tract and then goes to the throat, and not from the from up to down. So it's like from bottom up. And he says when there's another professor that when he reads the CAT scans, it feels like in the earlier stage, the patients only show infections at the bottom of the lung, like these fuzzy glass. I'm not quite sure how to translate that. And then it becomes like entire regions, and then it progresses upwards, and it becomes what's known as white lump. I'm translating just literally, and I'm not sure if that's the correct medical term. And he says it is different from the what he has seen previously as the fuck 肾出性. I guess it's like the abundance of mucus. He said it's different from that, and it means that they cough, but it's like a dry cough, so no mucus would actually come out. You just cough. And then he says so that's that. And he said the difference between this and the avial flu, avian flu. The difference between that and avian flu is that the thing that the avian flu patient's secret is a lot, and then once you give them ECMO, they recover. A lot of the patients can survive without ECMO in 3 to 5 days, and they progress for the better very soon, and a lot of them end up surviving without ECMO within a week. So yeah, so this is quite encouraging. You essentially means the test kits are not bad. You just need to find the correct way of testing it. Maybe instead of swabbing their throat, you just stick them up their ass, and then ask them to shit. And that, which also means don't eat shit, or don't breathe shit. Either way, like potentially, like shit is infective. Infectious, and you have the a lot of the antiviral stuff is useful, and yeah. So false negatives, which is one thing I was really quite worried about. If you can't detect this stuff, how do you quarantine? Then maybe we'll experience some unpleasant detection attempts, having our asses violated, but it's better than dying. So yeah, overall, I would say this is not that bad. Alright, so let's see if there are anything I need to address. Nope. So that's it, and good luck to us all, and I think this is not as bad as it initially appeared to me. Bye.